warm welcome to our special program. And with the rise in the coronavirus cases and with the number of deaths rising in the country, the focus now has shifted to the testing facilities, health infrastructure, and the kind of research which is happening on the coronavirus. And Council for Scientific and Industrial Research is playing a lead role in this area. Joining me is Director General of CSIR, Dr. Shekhar C. Mande. I welcome you on the program. Dr. Mande, my first question to you is that the world has never seen times like these. And as a scientist and as a head of the institution, what do you really feel when you see the things around you at the moment?
You have quite rightly pointed out that humanity has not seen a crisis of this level for a long time. Even the wars that we have gone through, World War I or World War II, were very different than the war that we are fighting right now. And the thing is that the virus actually does not distinguish between the class or religion or the skin color or the language that you speak or your nationality. It affects everyone equally. And therefore, it's the need of the hour that humanity comes together and fights the war together.
Dr. Mande, how difficult is this period as far as the research is concerned? Because there is a word that there is no treatment for the coronavirus, there are no vaccines, and world over, everybody is saying the same thing. So, do you see this as some kind of an advantage for all the countries across the world? And then later, of course, what India is doing and what India is focusing?
From the science and technology perspective, it's a challenging issue. Not that the family of viruses that coronavirus 2 belongs is called the SARS-CoV-2 virus. They have been known, but developing a new vaccine or new drug is always challenging, and that's what the scientific community is actually facing, that particular challenge right now. And there are sufficiently good leads that all of us have, that many people around the world are working on those leads at this moment.
How many countries are taking a lead as far as the development of vaccines is concerned, and by when do you actually expect that the vaccine will be in the market?
So there are many countries who have begun the work on the potential vaccines. For example, US has begun trials about 2 days ago. They take patient sera, people who have recovered, and inject it into the people who are severely affected by the disease and try to see whether that would work as an antidote. That's a good strategy that they have begun. But there are some people who are actually trying to identify the surface antigen of the virus and trying to see whether the surface antigen can also be used, a purified surface antigen can be used as a vaccine. So there are multiple approaches that people have tried using them.
What is India currently doing, and if I could ask you, what is CSIR actually doing as far as the development of vaccines is concerned on coronavirus?
So before we come to vaccine, if you allow me, I will talk of what CSIR strategy is. We have a five-pronged strategy that we have adopted. The first one is surveillance, including digital and molecular surveillance, how people are getting affected, and we are going to develop epidemiological models based on those. And we have tied up with some of the major companies around the world who will bring in expertise in artificial intelligence and machine learning in developing these models.
Okay, so apart from the Indian companies, you are roping in the companies from across the world as well.
That's right. The companies like Intel Corporation and all, they have already tied up with us in this particular respect. The second aspect that we are focusing on is in diagnostics. So we want to actually get into rapid diagnosis. The currently approved test in India is only the RT-PCR based, but there are other methods that are being developed. We are trying to develop them as well. The third aspect is about drugs and vaccines, and there where I'll come to about vaccines, what you asked me about. And there are several new therapies that people are actually trying out in both these aspects, drugs and vaccines. There's a third aspect. The fourth aspect in hospital assistive equipments, for example, PPEs or the protective equipment, or the ventilators or the masks and enrichment of oxygen. So these are all the scientific things that we should be working on, and CSIR has begun work on those. And the fifth one, which is the most important administrative aspect of it, is developing supply chain models for all of these that you can think of in each of those.
So Dr. Mande, these five prongs which you are talking about as far as your digital monitoring, diagnostics, testing, supply chains, all these things are concerned. So have you tried to connect each of these prongs with a particular corporate A, B, C, or is it like with all the five prongs you're reaching out to them together? What is it like?
No, actually what we have done is we approach corporates and some of the corporates were very generous in approaching us.
Okay.
And almost every corporate that we approach or they approached us, we have actually designed a strategy on what the corporate strength is, what our strength is, and how we can leverage the two strengths together. As you would be aware, in scientific laboratories, we can actually bring any research to a particular concept. But beyond moving that beyond a concept is how do we deploy it in the field at a large scale is the strength of any corporate. So we are bringing strengths together from both the corporate as well as scientific research organizations, and together we hope that we'll be able to deal with the situation much better.
There is a feeling, Dr. Mande, that with the rise in the number of corona cases, every day it's increasing, and in fact in the last 5 days the increase has been phenomenal. It's crossed 1,000 mark now, and with also the number of deaths rising. But my major question to you is that are we testing enough in the country?
That's a good question. The testing is always going to fall short at this moment, because the numbers that we are going to see are in a much larger scale than what we are seeing right now, and therefore we are kind of having to deal with the number of testing centers. And the strategy that we have adopted in CSIR labs is not only that different academic labs become part of the testing centers, we are taking approval of ICMR in this particular regard, but also these testing centers start training more people so that they can test. To give an example, our lab in Hyderabad, the Center for Cellular and Molecular Biology, or CCMB, are now training large number of people from nearby medical colleges and primary healthcare centers so that this can be scaled up at a very short time.
Okay. So you mean to say that at the secondary and the tertiary level also the health workers are being roped in and they are being taught to how to test, but what about the testing facilities? Because training is fine, training of personnel of course is an important component, but when you don't have that kind of an infrastructure, the testing kits, how do you really deal with the situation then?
So that's where some of the corporates have been very generous, and they have come forward and said that we will use our money in supplying these testing kits or equipments to many of the hospitals where they lack the facilities. So the corporates have been very generous and have told us that you identify which hospitals and all, and we can actually generate those facilities even in small hospitals.
You just spoke a little while back about this RT-PCR machine, and the cost of this machine of course is anywhere between 10 lakh to 20 lakh. Now, how many of these machines do we really have in India right now? And of course, there is always a need to augment it looking at the population of the country. So how do you really channelize this so that more and more machines are available?
Right. So the number of RT-PCR machines in India in different scientific laboratories is, my personal guess, would be of the order of about 500 to 1,000. That's my personal...
Across the country. Yes.
Across the country. And of course, many hospitals wouldn't have them because they may not have foreseen the need for an RT-PCR in the hospitals, especially the small hospitals. But what we have done, or some of the hospitals, these machines may be there, but they don't know how to use them, or they may be dysfunctional or something. A good example of this in Calcutta, the other day, our lab, Indian Institute of Chemical Biology in Calcutta, they went and donated one of the machines to the command hospital there and taught them how to use it. You know, because we have multiple machines in our labs, and therefore we can also spread this across different hospitals by donating our machines to the hospitals.
Okay. So, but as far as the digital monitoring is concerned, what is the crux of the strategy as far as digital monitoring is concerned?
So basically what Government of India has come out with a very nice strategy is that they are, the mighty, they have come up with a very nice portal in which all the monitoring would take place. You know, so basically people who are infected, who are their close contacts, whom they have come in contact and all, they would be monitored based on that particular aspect.
Okay. But Dr. Mande, when you're testing and monitoring, what happens is that the ambit of testing has to be decided by the government. Like initially we were checking on the travel history, then in the second phase we tried and broadened the ambit to the pneumonia patients and all the patients who are admitted with a respiratory problem. So are we to understand that as and when the availability of the machines, the availability of the kits increase or enhance, so do we increase that ambit?
Of course, the more we test, the better. And as you would have seen, even the WHO Secretary General actually made an appeal in his initial days itself that test, you know. Right. And the testing is the one which is actually going to help us in the long term in trying to monitor how the disease is spreading and thereby how to contain it. if we were to contain it, how we will actually contain it based on this testing.
Just a few days back, WHO did make a statement that lockdown alone is not the answer unless we are able to contain the second and the third phase of virus transmission. So do you see a likelihood of that happening? We don't want to alarm the viewers by any statement, but it's just that this question is coming in the minds of the people. So what would you really have to say on this?
No, lockdown is very useful in trying to break the cycle of the virus. Right. So what government has done is extremely commendable, is announcing this particular lockdown so that people don't get into contact with each other, especially the spread of the virus, that cycle, if that can be broken. I think it's a very effective way of containing the infections where they are. But beyond lockdown, we also must look at scaling up of our testing, and once a patient are tested positive, then providing them adequate medical care in those procedures. I mean, that is actually very important to think about.
So lockdown also gives time to the health officials, research institutes to get more prepared for the future?
Absolutely, it does.
Okay. As far as the development of drugs is concerned, that's also a very important aspect. And you would be able to correct me if I'm wrong, that there is a feeling that there is a question rather in the minds of the people whether at all the HIV drugs are useful in the treatment of coronavirus or not. What does the research actually say, and what has been your experience so far?
Well, it so happens that some of the HIV drugs are being tested against corona, but that is because of certain molecular features that HIV has might be similar to that of corona. You know, but not all HIV drugs can be straight away used for corona. That we have to realize. The drugs which are under test around the world are of 3 or 4 different major categories. For example, chloroquine and hydroxychloroquine is being tested in the clinics. There are other drugs which are in patent, remdesivir and favipiravir. They are also being tested. Also, lopinavir and ritonavir, they are also being tested. And we are hoping that this test clinical trials also would begin in India very soon. Apart from this, there are certain traditional ways of plant extracts and all in India, which are known to have activity against similar symptoms. And we're also getting into testing of those very soon.
So all this basically is in an empirical stage right now.
That's right.
Okay.
But it will begin very soon, these
Okay.
tests.
So a lot of things are happening as far as the research on coronavirus is concerned. We take a break at this point of time, and when we return, we talk about the paper basis test, which is being talked about globally, and is India really vying on that test? Come back to you in a moment.
When you do not like limits, when you are a seeker, a dreamer, and always questioning what if, why not, and how, when you want to know every bit of it, when you want to explore every inch of it. DD Science from 5 p.m. to 6 p.m. every Monday to Saturday.
Welcome back. You're watching our special program on the research on coronavirus, and with us is our special guest, DG CSIR, Dr. Shekhar Mande. Dr. Mande, a lot is being talked about as far as this paper basis test at Harvard is concerned. A lot of people are talking about it. How easy is it, and how do you really go about this test?
So this test is based on a very famous enzyme that many people would have heard of. Is called CRISPR-Cas system. That is being developed simultaneously at both MIT as well as University of California, Berkeley. And they are making their protocols open, as is a lot of understanding across all the research organizations around the world that any research that is happening on corona, we actually put it in open access so that anyone in the world can access this. Okay. And the paper-based test that we talked about is based on that CRISPR-Cas system. Our institute in Delhi, the Institute of Genomics and Integrative Biology, they are trying to develop this particular test, and we are trying to see what is the sensitivity and specificity and how quickly and how cheaply we can actually implement this particular test.
So this institute in Delhi basically is going on the lines of the Harvard test only, which is being done.
Similar way.
The similar
way, but the CRISPR that the institute has, our Delhi institute, is more specific for certain targets. So we're actually trying to use our enzyme for that. particular issue.
But in times like these, Dr. Mande, what has been your experience? Like what you said, that the entire research on coronavirus is very open and transparent. But sometimes, because of the geopolitical relations and sometimes strategic relations, what if a country doesn't get too transparent in times like these? And maybe if one country is out there to develop some vaccine and they hide from one particular country. It's just a very layman's question which came to my mind, so I thought I'll ask you.
I think if anyone does that, I would consider that as a regressive step.
Okay.
Because this is a time that humanity has never seen before. And therefore, it's important that entire humanity joins together in a war against corona. And therefore, it's imperative that everyone, whatever research that is being done, places in an open access, that anyone else can see it. And you never know that different people of different academic backgrounds can actually bring a lot of value. So if one person puts in open access, the other person can actually bring value in doing it much better. And we don't have much time, and therefore it's important that everybody places all the research that is happening in open access system so that anyone around the world can use it and make it better.
But as far as this paper-basis test is concerned, you already said that the institutes in Delhi and Hyderabad are already doing it, or rather in the process of doing it. So by when do you really expect the tests to get through and we see it happening quick and fast?
We are hoping that in the next few weeks, the test would be optimized. And as soon as the test is optimized and we get proper parameters, as I said, for sensitivity and specificity, then we will actually convey to ICMR that this test is as good as the RT-PCR, and they can independently verify whether what we are saying is right or wrong, and then ICMR's call whether it can be implemented in the field.
But when you talk about the test, Dr. Mande, everything boils down to the cost, that how expensive is the test going to be? So are we going in for a model where people can just walk into a clinic or a hospital and get themselves freely tested, or will they have to make a choice that, okay, you have to pay 100 or 200 or 500 and then you get tested? What is it going to be like?
Now, ideally, any test should be such that should be rapid, and it should be easily accessible, that is, the cost should be very cheap. And both these parameters actually we are trying to see whether we can achieve them in this paper-based test. At the same time, we should not compromise on the sensitivity or specificity. It would be catastrophic if a person is positive and you tell the person that you are not positive for coronavirus. That will be a catastrophe. Or the other way, that you would actually have the panic set in, where people who don't have corona, but you tell them that you have corona. So either way, it should not be right. And therefore, all these three parameters, that is, the test should be rapid, the test should be accessible financially to a large population, and the third, that we don't compromise on the accuracy of the test. All these three parameters we'll consider in implementing.
But for the middle class Indian, maybe they would afford a cheaper cost, as far as the test is concerned. But we do have a large population of, say, poor people, living below the poverty line, migrant laborers, all sorts of people are there. So for them, is the government really going to target some category of a test which is going to be freely available to them? Are you looking at something like that?
I think that is government's call to take. And ICMR is pretty competent organization. They would be looking at many different kinds of tests in the basket that come in, and ICMR would eventually take a call in the largest public interest of which of these are better, which of these are not better, and probably would recommend to the government what the course of action should be.
Right. Coming to the assistance to the hospitals and to the general public at large, the most often heard complaint amongst the people and amongst the healthcare workers has been that there are no enough personal protective equipment, masks are not available, gloves are not available, ventilators, respiratory machines. So how do you make that available? Of course, a huge package has been announced by the government, a 15,000 crore package, and still lots more to come. But how do you make it available so that it comes in the hands of the doctors, the healthcare workers and the people rapidly and steadily?
That's a very important point, and I must applaud the response of our industry. All the major industrialists in the country, and I don't want to name here because that would seem I'm taking only preferential names, but all the major industrialists in the country have come forward and said that they would do whatever it takes in meeting the shortfall of any of this equipment or protective gear and whatever. And not only they have actually said that we will do it, they have started working on it. So we must applaud our industry that they have come forward in this moment of crisis.
the Kishore Vaigyanik Protsahan Yojana Fellowships provide students with a monthly stipend of Rs 5,000 during their undergraduation and Rs 7,000 during their post-graduation. Along with the monthly fellowship, they are also entitled to receive a contingency grant that can be spent on consumables like laptops, books, and stationery. The objective of the KVPY Fellowship is to identify students with talent and aptitude for research, help them realize their academic potential, encourage them to take up research career in science, and ensure the growth of the best scientific minds for research and development in the country.
DD Science showcase the latest achievements of Indian scientific research organizations and universities. DD Science will make science education accessible to all and will inspire youth towards scientific research and innovation. DD Science will spread scientific temperament and rational thinking. DD Science will open your eyes and blow your mind. What others call fiction, we call a possibility. When others accept, we challenge. DD Science.
Welcome back. You're watching our special program on the research on coronavirus, and with us is our special guest, DG CSIR, Dr. Shekhar Mande. We've seen visuals of the tribal women wearing a mask made with the leaves, and a lot of experiment is being done in the villages. So are we trying to rope in these self-help groups at the village level, at the rural level, so that they can have alternative means of making a mask or making a hand sanitizer? Even the Prime Minister has spoken about these things.
Absolutely. See, what we are seeing, also witnessing, is one fact that people migrating from cities to villages back is one of the unexpected things that actually happened in this time of crisis. And what CSIR would like to see is how do we support people when they go back to villages? Can we actually promote rural entrepreneurship out of these? And we would like to actually undertake work with the help of NGOs, whether we can teach people how to make sanitizers in villages, whether we can teach people how to make masks in the villages, and so on and so forth. So whatever technology we have on our board, we are actually going to try to work with NGOs and try to see whether we can start teaching people in the villages to make on their own.
So has this process begun, and any particular villages, maybe in the first phase or the second phase, you're going to look at, or it's going to start from a particular pocket of the country? How's it going to be like?
We have just started talking to the NGOs, some of the large NGOs in the country, and they have come forward, and we are just discussing with them how do we quickly implement this particular thing with them. So the initial discussions have just begun. It will probably take another week or so to start implementing and teaching villagers on how to create their sanitizers, their masks, and so on and so forth.
One last bit, Dr. Mande, before we wind up the show, is the supply chain. That how do these things, whether it is ventilators, whether it is respiratory machines, or whether it is PPEs, gloves, how do they reach the chemist shop? And how do they reach the doctor? So what is the kind of supply chain model which you have thought about or you have collaborated with the corporates?
Right. So supply chain model is an extraordinarily important issue in the entire mitigation process. We start with raw material being available in particular locations. Those raw materials being used for manufacturing particular kind of equipments, say gloves or protective gear or whatever, or even ventilators or medicines or whichever. And then a supply from the manufacturing site to the either the medical shops or whatever, and then from there giving to the public. So the entire chain which starts from raw material to the public is a very important aspect, and that should be available in different corners of the country. The supply chain model is being now worked out by our laboratories, principally Indian Institute of Petroleum in Dehradun, in collaboration with one of the large software companies in the country, and they are working it out together, and we hope to implement that very soon for each of the things that is required for mitigation. Say gloves, sanitizers, ventilators, medicines, vaccine, diagnostic tests. For each of these there has to be a supply chain model, and our lab in Dehradun, in collaboration with a software major, is trying to develop these models.
So what would you tell the people towards the end, because we've seen a lot of panic buying people stocking up sanitizers, stocking up gloves, and then suddenly we see a shortfall in the market. What would you really tell the people at the moment? Of course, what you've assured us is that there's going to be no shortage in future, but any last word from you for the audience who's going to watch this program?
I would just appeal to the audience not to panic. Follow basic hygiene that the government recommends. Government has come up with very strong recommendations on how to protect yourself against this particular disease. Maintain social distance and wash your hands with soap for about 20 seconds. And please keep watching out for the guidelines that the government issues from time to time. Government is here to protect you and you are here to protect yourself. So please do that, and I'm sure we'll win the war against this dreaded disease.
So as Dr. Mandey has assured that you need to respect the hygiene, you need to follow the social distancing and keep following, of course, the government guidelines. So give us your comments and suggestions as to what you felt about the program. There's an email ID flashing on your screen. You can write to us if you have a particular recommendation for an interview or for some kind of a panel discussion which you want on this platform. From me here, goodbye.